Hey everyone, how's it going today? My name is Zach Courier, and I am joined by Dr. Daron Smith of the Queen City ENT in Charlotte and Monroe, North Carolina. How are you doing today, doctor?
Doing great. How are you doing?
Good, good, good. Yeah, as I mentioned, you guys have the two locations there at Queen City ENT. It's the big three over there, right? You said you've been practicing out there for 22 years, but in your first year at Queen City, correct?
Yep. Yeah, there's three of us that formed our own practice, and we just opened up November of last year.
Excellent, excellent. So obviously, 22, 23 years, you know what you're doing. How did you get into ENT? Where did the light bulb go off that this is what you wanted to pursue? And the
Like
rest is history.
third year medical school, you start doing these rotations, and after you get into a couple of them, you kind of see what kind of personalities fit your own. I definitely knew I wanted to be some type of surgeon, but some of the orthopedics and neurosurgery, they're kind of high strung. The ENTs seem to be a little bit more laid back and friendly, and I just love the head and neck anatomy. So kind of just drew me to it. I think it's just like draws like.
Yeah, absolutely. And what specifically head and neck anatomy? Obviously, that covers so much, right? But
Well, it's the I mean the during even the anatomy dissection, the head and neck, it's got just so many intricate, it's everything comes out of your neck basically, and so it's just you have to know a lot, and when you operate in the neck, just something that it drew me to it, and
yeah.
specifically, I mean, I probably do more of sinus stuff than anything.
Okay, yeah. Yeah, we talk with EMTs who talk about, infant to elderly, right? I mean, you can treat someone's baby and them and their parents and their grandparents and that kind of great referral network that you guys are able to build from, doing great work and offering a safe place. Tell me what that looks like, on the heels of COVID, right? And the coronavirus. How you guys are handling that, staying safe, and what people can expect. I know sometimes people are a little agoraphobic in general, right? But especially like, oh, do I want to deal with my deviated septum right now? I don't know. What does that look like?
We try to, keep it as safe as we can. We've cut down on the number of patients we see every day just simply because we spend the time to clean the rooms properly, let it sit for a certain period of time. We're running some HEPA filters. Of course, we're asking all the screening questions, taking their temperature before they get into the door, limiting the amount of people that come in. So we don't want big families coming in. We just want that one person if they can, unless they need
Right.
some kind of support. Um, and of course, everybody's just following the guidelines like they should.
Nice. So back to sinuses, you said that's probably what you focus on the most. We talk a lot about how people go, I have, sinus migraines or sinus disease or what it is. Sometimes it's hard to put to words to what people are feeling versus what you see once you finally get in there, right? So walk us through that typically, what people say, what you're seeing, and what you sort of prescribe and procedures that may or may not follow with that.
Well, for people with sinus disease, you always want to find out, is it really sinuses? Because there are a lot of people that come in and they're complaining of this kind of facial pain or headaches, and yet all the other symptoms don't seem to kind of really correlate. So you have to figure out, is it truly a sinus problem? Then
Sure.
once you realize that, then you got to make sure they get the maximum medical treatment. You exhausted all the medicine and the therapeutics that go along with it. And then finally, you do the workup, CT scan, and then get into, what is their anatomy and what would potentially be the problem.
Yeah, exactly. And where do those usually go, right? What you said
Yeah.
therapies or procedures. So
Yeah. Yeah. So,
what are
there's
typical therapies?
traditional endoscopic sinus surgery where we're actually removing some tissue to make the sinuses a little bit larger openings. And then you got the office based like balloon sinuplasty, where under just local anesthesia, small balloons are used to dilate the sinuses. And that's definitely a lower downtime within 48 hours. You're back to work. Um, so there's advantages and disadvantages of each one of them for sure.
Right, yeah. And when you're removing, again, that's at the hospital, right? If you're
Yeah,
removing
it's under
tissue.
under general anesthesia.
And then
Uh,
it's always interesting to me that the idea of after a nose surgery, it seems to get worse before it gets better, where things get plugged up and congestion and, a few days of that kind of drainage and downtime, and sounds kind of miserable, but
Yeah, it's everything swells a little bit.
yeah.
And the more minimal you do, the less swelling you get, of course. And sometimes you can be, you don't want to be too over aggressive in doing these things.
Mm-hmm. Do you guys do any cosmetic work over there? I mean, if someone says, yeah, you're gonna fix my deviated septum, can you shave a little off the top? Do you do that, or would you refer that out to
Yeah, I usually refer that off to somebody else. We typically, our practice sticks with the functional side of the nose, basically. If they want some cosmetic work, I do know some physicians in town who are ENT trained that also do plastics, and so I'll send it to them if they really want something changed with their nose.
Mm-hmm. Yeah, no, I could certainly imagine. Speaking of that, right, cosmetic versus this, basically everything that you do is covered by insurance, I would imagine, right?
Yeah, most everything. There is a couple procedures that, if they want it, can be out of pocket, because sometimes insurance companies don't like to recognize certain codes, and we still make it available though.
Yeah.
Hey, I'm sorry, but there's somebody blowing leaves right outside my window here.
Oh, that's okay. I can't hear it myself, but yeah, it's just going to be bothering you, not me. So no, we talked a little bit offline, Dr. Smith, about something going on right now, a therapy or a procedure for to kind of combat sorry, I can't the words sleep apnea, right?
Yeah,
And
yeah.
for, another alternative to having a big CPAP machine on every night, that's just not viable for some people. You have another solution that you're implementing over there. Tell us about it.
Yeah, over the past year, we've got into something called Inspire, and it for the people who can't tolerate CPAP, and sometimes they can't tolerate CPAP because their nose is blocked off. Because all these consults I'm getting for this procedure, they may have a deviated septum or large turbinates, and they would benefit from improving that, which can make them make the CPAP more effective. But this procedure, if you can't tolerate CPAP, it is a device where we are finding the nerve that makes your tongue move. There's some fibers that make your tongue come forward, and some make it move side to side and pull it back. Well, we're finding only the fibers that make your tongue come forward, wrapping a little electrode around that, and a little wires down to a pacemaker, a kind of a pacemaker. It's a computer with a battery, and then there's another sensor that goes between your ribs. When you at nighttime, basically you click a button, you fall asleep, and then it starts kicking on. And what it does is every time you start taking a breath, it makes your tongue stiffen up and come out just a little bit. And so your airway doesn't collapse. And it's all the patients I've done so far are extremely happy with it.
That is wild. That is so crazy. Because the numbers better than I do, but what portion of the population deals with sleep apnea?
Well, if you're a man over 50 and snore and feel a little tired during the day, you probably have a little bit of sleep apnea. It's very common. I don't know the numbers, percentage wise, but there are a lot of people out there with CPAP, and unfortunately, a lot of them just kick it off to the side, and they're so frustrated with it that they end up not using it.
But people, again, affecting your sleep cycle, right? People can wake up something crazy like 150 times a night or something wild like that, right? So it's certainly worth addressing. Now, when they are looking to maybe do this, they've heard about it or whatever, do they have to do a sleep study first to qualify, or how does that?
You have to be a candidate for it. So you have to have a sleep apnea that's considered moderate to severe. It can't be, super mild, or it can't be so bad that we won't be able to control it. It has to be. I have to have a sleep study within 18 months, the current one, and then we do something called sleep endoscopy, where we're actually putting somebody under sedation and examine their airway to see how it's collapsing. And it depends on how it collapses whether or not they're a candidate or not. And you have to be under a BMI of 35. And unfortunately, that does rule out a fair amount of people, but it would be surprising to know how many very thin people have pretty severe sleep apnea.
I'm sorry, it would be surprising, as in you would
That
expect hardly
that
any.
I didn't even realize how many people who are almost underweight can still have sleep
Wow.
apnea. Yeah, so it's not just people that are obese.
Wow, that is interesting. I didn't know that either. And that just comes down to a little bit of the tongue reflex, as you'd
Yeah,
mentioned.
it's just the neuromuscular, what your basically tongue and sidewalls are doing when you're in that sleep stages. That it's just not enough tone to keep your airway open.
It's crazy. Yeah, it's
So,
hard to wrap our heads around sometimes why these things happen, but thank God for ENTs, right? That's why you're there. Well, Doctor, this has been a real pleasure kind of chatting. Do you have any last advice for us before we let you go? I mean, if you could just, we kind of like to treat this like a free consult a little bit, and kind of the questions people address. I mean, so often people live with these issues. They're not breathing right, they're not sleeping right. It affects quality of life, but we'll put it off for one reason or another because we're humans and we're stubborn. What advice do you have for folks
well, the
now?
most thing is try to if you're bothered by something, if it's affected your quality of life, at least try to seek some opinion on it. Because there's just so many people that come in and after they've had something done, they go, I can't believe I've wasted the last 10 years of my life living like this. They just, and it's kind of a shame sometimes. Like I said, even with these people with the sleep apnea, I've done it when I'm doing that endoscopy. I improve their way, do a septoplasty, and then they're so happy with that they say I don't need anything more because now I can use my CPAP. And so it's just if you're having a problem with something, at least get evaluated.
That's awesome. Well,
Yeah.
thanks again so much for your time today. I'm sure this is helpful for so many. And yeah, we ask that yeah, you keep up the good work, stay safe, and almost to the end of the year. So you guys have done a great job. And thanks again for chatting.
All right. Thank you.